A border can't stop a virus, but Ugandan authorities are trying. 3 Ebola cases have been registered in the country. It's the first known cross-border spread since an outbreak began in the neighboring Democratic Republic of Congo last August. Fears are growing that this might only be the beginning.
The Ebola outbreak in the DRC is still going on. And by today, we have over 2,000 confirmed cases. And so the probability of more cases crossing over from the DRC into Uganda is very high.
Ebola isn't new to Uganda. The country has seen 5 outbreaks of the disease since the year 2000. It has now stepped up efforts to contain the virus, screening every person coming in from the eastern DRC. The government is also deploying an experimental Ebola vaccine for healthcare workers along the border.
We are very cognizant that many more people will come in to support the response, and these many more people will not be vaccinated. And so from Friday, we shall begin vaccination again of frontline health workers, other workers, and ring vaccination for the contacts.
Because of past successes in combating the disease, Uganda is widely regarded as being at the forefront of the fight against Ebola. But faced with the most recent cases, many Ugandans feel uneasy and wish their country did more to educate citizens about the virus.
The government has not done enough to sensitize people about Ebola, because I think the acknowledgement should have started from the rural areas.
But you know, when people have the symptoms, they want to hide, and then they mix with the greater population, which now spreads the disease to wider areas.
Me, I'm safe because I haven't seen any symptom of Ebola. But I think the government should also continue to sensitize people about the Ebola. I think they have confirmed some 3 cases as per now. It means we are not safe.
Tomorrow, the World Health Organization is set to decide whether the Ebola outbreak, now that it has transcended the DRC, should be declared an international health emergency.
All right, a troubling situation there. We can speak to Alan McDonald from Save the Children in Uganda. He joins us from Kampala. Hi, Alan. Can you give us more details about the situation right now in Congo and in Uganda where you are?
Thanks. Well, as was said in your report, there's been an outbreak of Ebola in Congo now for a year almost. We've seen more than 2,000 cases, hundreds of them children, more than 1,300 deaths. But this is the first time that it's spread across the border into Uganda, so people here are obviously very worried. In Uganda, we now have 3 confirmed cases, 2 of whom have already died, a 5-year-old boy and his grandmother. There's another 3-year-old boy, very young, who is currently being treated. And these are all in the west of Uganda, near the Congolese border. They're all from the same family who recently came back from Congo. Lots of people cross the border back and forth to see relatives, go to markets, and so on. There's a lot of movement, and there's a lot of screening at the border in place. But now that we have the government is really stepping up the response to focus on stopping it spreading further. So we need a lot more education of the community, vaccinations for health workers and so on to stop it spreading.
Alan, how would you compare this outbreak to the last big outbreak of Ebola in Western Africa in 2013 and 14 and onwards?
Well, this is definitely the biggest outbreak since then, but so far it is on a smaller scale, fewer cases and so on, but it shows no sign of ending. And now that it's crossed the border and potentially could also cross into other countries in the region, this is really the time to act to make sure that it doesn't grow into a crisis of the scale that we saw in West Africa. It's also a very different kind of context. DRC, Congo has one of the worst conflicts in the world, which makes it very difficult to respond. And Uganda is hosting one of the largest number of refugees in the world. So it's already struggling to cope with the refugee crisis, and now on top of that, it has Ebola to contend with.
Alan, more than 1,300 deaths in Congo, hundreds of children, you're saying, and now this is spreading. How worrying is this to you?
Extremely worrying. These are the first cases in Uganda, but it can spread very quickly if it's not contained. So the Ugandan government is leading the response and has a lot of experience in dealing with these kind of outbreaks. But it really will require much more international support, particularly as someone mentioned in your report, it's really important that communities get the information and education about Ebola, simple steps that they can take to prevent it spreading, what to do if they see the symptoms, what the symptoms are. Mm-hmm. A lot of these communities are very rural areas. There isn't a lot of access to healthcare, so we really need more support to get into those communities and explain to them what is going on and how it can be prevented.
All right, Aceng McDonald from Save the Children in Uganda. Thank you so much for sharing your insights with us today.
Thank you.